Lipedema is a fat distribution disorder. This disease occurs on about 11% of the female population, so it's a disease only women are affected. It occurs on the arms and on the legs, and sometimes we see lipedema symptoms on the breast, on the belly, and even on the back. The main difference to obesity is that it's painful and the patient can't lose weight by sports and by diets on the arms and the legs. We have the classification of stages and types. The stages are a thickness of the fatty tissue is stage 1 if it's a little bit more, but the skin is very even. Stage 2 is the wavy skin, and stage 3 is with overhanging skin. We have also a stage 4, and this is with lymphatic fluid problems. And the classification of types is type 1 is only affected on the hips, type 2 is with the knees affected, and type 3 is with the lower legs. Type 4 means also the arms are affected by lipedema, and this also always includes pain and the thickness of the fatty tissue, and these are the main symptoms of lipedema. The recommended therapy for lipedema is conservative for about a time period of 6 months. This means lymphatic drainage, compression garments, flat knit, class 2, custom made, and water sports, because water sports is improving the lymphatic drainage on the tissue, and this can help a lot of patients. If this is not helping, we can discuss the surgical therapy. This is liposuction, and this is what I offer the patients. So these both lines of therapy are available, conservative and surgical. The best technique for lipedema treatment is the PAL liposuction. This means power-assisted liposuction. We use vibrating cannulas to remove the fat out of the tissue. It's a very tissue-friendly method because I don't have this hard water jet, and I can achieve very aesthetically and good functional results. One advantage is that I don't have a very swollen tissue because I don't need a water jet. I have only my vibrating cannulas, and so I can get a very smooth therapy to the tissue. The recommendation of the doctor societies say it's good to treat before hormonal changes like pregnancies or like menopause. So don't wait too long if you have the diagnosis of lipedema, because it's an ongoing disease. If you wait too long, you get in the late stages, and this is really hard to treat. So better to treat in early stages for better aesthetically and functional results. The surgical results of lipedema liposuction are long-lasting. That means even after hormonal changes, they will not come back, the pain again, the lipedema symptoms again. And this is a very effective treatment for lipedema, and we have a very low rate of recurrences. If you have the diagnosis lipedema or you think you are suffering from lipedema, please go to an expert for lipedema treatment. We here at Amwaj Polyclinic do an ultrasound examination of every patient to check how looks a good treatment plan, and then we are doing a briefing for the patients, including blood tests, phlebotomist examination, and so on. Lipedema is a disease that can be treated very well, so don't hesitate to start the treatment soon. It's normally first the conservative therapy, and if this is not helping, go to a surgeon who can help you.